Trauma, a word that holds deep meaning for millions of people. It's not just about what happened, but how it changed the way we think, feel, and live. Post-traumatic stress disorder, or PTSD, can turn daily life into a silent struggle, one that often goes unseen. In this video, we'll explore what trauma really is, how PTSD develops, and most importantly, how healing is possible. Welcome to Mind, Health, and You, where we talk about the mind, emotions, and the path to inner peace. Trauma isn't always about physical harm. It's any deeply distressing event that overwhelms your ability to cope. It could be a serious accident, abuse, war, or even emotional neglect in childhood. When something shatters your sense of safety, leaving you helpless or terrified, that's trauma. But here's what's important to understand. Two people can experience the same event, but only one may develop lasting trauma. Why? Because trauma depends not just on the event, but on how our brain and body process it. When trauma happens, your body's alarm system, the amygdala, goes into overdrive. It floods your body with stress hormones, preparing you to fight, flee, or freeze. For most people, this response fades with time. But for others, the brain keeps reliving that moment as if the danger never ended. PTSD, or post-traumatic stress disorder, develops when that traumatic memory stays stuck in your mind and body. It's like your brain keeps pressing replay on a scene you want to forget. Common symptoms include flashbacks or nightmares that feel incredibly real, avoiding places or people that remind you of the trauma, feeling constantly on edge or easily startled, emotional numbness or detachment, trouble sleeping, concentrating, or trusting others. These symptoms can appear weeks or even years after the trauma. And they don't just affect your mood, they change how your brain functions. Researchers have found that PTSD alters key brain regions, the amygdala, hippocampus, and prefrontal cortex. The amygdala becomes overactive, constantly scanning for threats. The hippocampus, which helps distinguish past from present, shrinks in size, making it harder to realize you're safe now. And the prefrontal cortex, the logical, calming part of your brain, becomes less active, which makes emotional regulation difficult. This explains why people with PTSD often feel stuck in survival mode, reacting to life as if the trauma is still happening. Here's the hopeful truth. Healing is absolutely possible. The brain can rewire, and the body can learn to feel safe again. Therapies like cognitive behavioral therapy, CBT, EMDR, eye movement desensitization and reprocessing, and somatic experiencing have shown powerful results. These approaches help the brain process memories safely without reliving the pain. In addition, mindfulness, breathing exercises, and grounding techniques can calm the body's stress response. Simple practices like noticing your breath, naming what you feel, or focusing on physical sensations can remind your body that you're safe in this moment. Support from loved ones is also crucial. Trauma isolates you, but healing happens in connection. Talking about it, seeking therapy, and joining support groups can make all the difference. If you're living with trauma or PTSD, remember, Your story isn't defined by what happened to you, but by how you choose to heal from it. Recovery doesn't mean forgetting. It means learning to live fully again, with strength, compassion, and awareness. Be patient with yourself. Healing takes time, but every small step counts. And if you or someone you love is struggling, reach out. You are not alone. Thank you for watching Mind, Health, and You. If you found this video helpful, please like, subscribe, and share so we can continue spreading awareness and hope.